Coming of Age is coming up next. I'm your host, Josh Newby. It's open enrollment season, and with it comes the usual questions and confusion around Medicare, Medicare Advantage, private insurance, and more. But fear not, we've assembled some experts to break it all down for you. Open enrollment season also brings the holidays, which can sometimes mean depression and sadness. We're talking with Lakeview Center about how to combat those holiday blues. Stay tuned. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. Christmas songs and Hallmark movies tell us the holidays are the most wonderful time of year. But what if stress, fatigue, and sadness overwhelm those feelings of comfort and joy? Well, Dr. David Josephs from Lakeview Center is with me today to talk about the holiday blues. Dr. Josephs, thank you for coming on today.
My pleasure, Josh.
To get started, share a little bit about your background. What do you do at Lakeview?
I'm the clinical director at Lakeview. I've been there since the time of Open-enrollment.
Okay.
Those of us who do time in hurricanes. 25 years or so. So oversee the clinical services at Lakeview Center.
Okay. Now, as I said in the intro, you hear holiday songs on the radio, you watch Christmas movies, everybody's happy and in love, but many people don't feel that way, and they call those feelings the holiday blues. Is there such a thing, though? Are the holiday blues real?
It's a real thing, and most of us have experienced the
Sure.
holiday blues. Some of it is actually related sometimes for those of us in the South, the change in the time. So we have shorter days, less light. Also, there's an anticipation of things to come, stressors,
Sure.
spending money. Although we love and like our family, sometimes being around family can be stressful.
Definitely.
So these are real things that we all go through. They are not most times debilitating.
Okay.
They're just things we should prepare for.
So what are some typical symptoms of the holiday blues?
The typical symptoms is just feeling a little bit down, anxious. People will get anxious because they're anticipating maybe meetings. They may be anticipating financial issues.
Sure.
And so in some ways, we actually create the holiday blues sometimes, and then we go through the holidays and say, oh, I didn't need to worry. It actually worked out real good, right?
So I'm curious, are there factors either internal or external that can sort of aggravate the holiday blues, make it worse?
Yeah, the external factors, I've mentioned the sunlight and so forth, but some of the external factors also are that we put ourselves in situations in the holidays that we usually are not around. We're usually in control of our environments, in control of our homes. We're going into other people's homes sometimes.
Right.
For those of us who like control, that can be pretty stressful.
For sure.
So some of the external factors is we're just out of our comfort zone. We put ourselves in positions that are not usual for us. Internal, we do things, blues, depression, all these things in many cases are brain issues.
Sure.
So during the holidays, we do things to our brains that we don't sometimes do through the rest of the year. We sometimes drink too much.
Right. Of course.
We often don't sleep like we used to sleep. We don't exercise the way we used to exercise. And in some ways, we might even not think the way we used to think. We put more pressures and stresses on ourselves that are internal to us, and that really is manageable.
I know because I've experienced the holiday blues, as I'm sure you have, and you can feel quite alone, right? You see everyone else having fun, but you feel like you're the only one who's sort of or sad or off. But is it pretty common? Chances are other people also going through that?
I would suspect many of us.
Yeah, yeah.
It is very common. And again, it's also manageable. The holidays also, particularly for those of us who are a little bit older, brings about times for remembrances.
Sure.
And so if we're from large families and some members of that family are not around, it can bring some sadness, but the sadness and the emotion does not necessarily have to be a negative thing.
Sure.
You take out pictures and you look, yeah, you might shed a tear or two, but it's not tears of depression, right?
Right.
It's tears of, I so much loved my, whoever it was,
Right.
spouse, my child, my parents. And so people, we ought not to be afraid of emotion.
Right.
Emotions are not necessarily bad. Tears are not necessarily bad.
Sure. It seems almost like the holidays can almost be a catalyst for processing some of those buried feelings.
Yeah, and that's what I'd encourage folks to do, not only during the holidays, but through the rest of the year. We have emotions for a reason. We get sad for a reason. These are some protective factors for many of us. Sometimes stick with the feelings, share the feelings. Do we remember my dad, my mom? And often with that sharing actually turns the holidays blues around.
Yeah. But there is, of course, a difference between the holiday blues and like actual legitimate depression.
Correct.
So how do we tell the difference? At what point do I suspect, okay, maybe this isn't just the holiday blues?
Great question. And it probably is not the holiday blues if 2 or 3 weeks after the holidays, a month after the holidays, we're still having some of the same sadness.
Sure.
We're not sleeping well. We're not eating the way we used to eat. We have negative thoughts. We have sense of not belonging or being burdensome to others, and these feelings or these thoughts persist.
Okay. And what recommendations do you have for those individuals? What's the first step to take?
The very first step is don't do it alone.
Okay.
Most of us can reach out to somebody, whether it's family, our ministers, friends. I think your question, Isha, is do all of us go through this?
Right.
All of us go through this.
Sure.
And I think maybe us just understanding this is a human condition.
Right.
And sometimes it's just a brain condition, and sharing stuff is sometimes the best way to feel better.
Definitely. We have just about a minute left, but I was curious if you might expound on some coping mechanisms that exist for those who are experiencing the holiday blues.
Some of the major coping mechanisms comes from research, cognitive behavioral therapy, which is what we think leads to how we feel, leads to what we do.
Right.
Okay? We can manage what we think. We can rehearse what we think. I'm really a good guy. People really like me.
Right.
Maybe.
Well, we'll see, right?
And we can manage these thoughts that then affect our feelings, that then affect our behavior. And it's not magic, but people, I think, would be very surprised how much that works.
Awesome. Awesome. Well, great advice, very timely. I appreciate you coming on, Dr. Joseph.
My pleasure.
Thank you. Next, it's open enrollment season here on Coming of Age. We'll talk to some Medicare experts. Stay with us.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase. So you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
What does it look like when a life is truly changed?
I feel a sense of accomplishment because I built a house. This house has brought us financial independence.
It's a great place to raise a family.
Strength, fuerza.
When I look back where we've come from to where we are today, it makes my heart very happy.
Potential.
Potencia.
For me, this house means all of us together.
Sorry.
Security.
Security.
Every family dreams to have their own house. This house changed our lives.
Habitat for Humanity is at work in your community and around the world. Through shelter, we empower.
Medicare, Medicare Advantage, prescription drug coverage, it's tough to get a handle on all of it. But over the next 8 minutes, we're going to break it down for you so that you can feel confident and informed. Joining me are two representatives with Gulf Winds Credit Union, a longtime supporter of Council on Aging and a reliable resource for this information. Thank you both so much for joining us.
Thank you. Thank you.
Before we get started, share a little about your backgrounds.
Okay. I have worked for Gulf Winds for a little over 7 years. Okay. I started on the lending side and then moved over to the investment side about 4 years ago.
Okay.
And I've been with Gulf Winds for 10 years, and I am a financial advisor, certified financial planner, and independent agent for insurance with Gulf Winds.
So for those who are of age and who are maybe about to enroll in Medicare for the first time, what are some things they need to know? How is it different from private insurance?
It's actually very different in good ways. I think all of us know, as we're with an employer plan, we only have one insurance plan that we can go through. We have to just choose what they offer. So throughout, when you get into the Medicare plans, in Escambia County alone, there are 24 plans.
Oh, geez.
So that is great, but it can be confusing.
Definitely.
So we took it upon ourselves to learn a lot about it. Being financial advisors, certified financial planners, we realized that it can be extremely confusing.
Okay.
So we wanted to make sure that we knew enough for our members and clients.
Right.
And in essence, we talked to our board of directors at Gulf Winds, and we started providing that for our members during this open enrollment season. You know, when you turn 65 and you are retired or planning to retire, that is when you want to look into Medicare. Okay. If you're currently still employed, you don't need to worry about it.
Right.
If you're happy with your employer's insurance, don't worry about it. You'll automatically be enrolled in A and don't have to worry about anything else. Okay. So I think, you know, just being able to sit down, come to one of us, or, you know, obviously it's several other people in the community and get information is, you know, there's a lot of opportunities for you.
Right.
And that's why it gets a little confusing.
So there's different, speaking of confusing,
there's
different parts of Medicare. Sure. They all mean different things. Go through that for us.
Okay. So just like you said, Medicare does consist of several parts. So there's first the original Medicare, which is considered your Part A and your Part B.
Okay.
So your Part A, you are automatically enrolled into Part A when you turn 65. Part B, you actually enroll in by yourself when you are ready for Medicare to be your primary insurance.
Gotcha.
So the Medicare Part A is actually for the hospital coverages. Your Medicare Part B is for your doctor coverage. Okay. So after that, there is an additional coverage that you can get. There is a supplement that you can get that will kind of cover that 20% that Medicare does not cover.
Right.
And that goes hand in hand along with what is called a prescription drug plan or a Part D plan.
Okay.
Or you can go to the other avenue, which is an Advantage plan. So there's a lot of steps involved with the Medicare, but that is the main parts to Medicare.
Okay. And there's an open enrollment period, right?
There is.
Tell us about that.
There is. So the open enrollment period is from October 15th through December 7th.
Okay.
And what that enrollment period does is it gives all of the enrollees the opportunity to make any changes they may want to make for the upcoming year.
Okay.
Okay. There also is an initial election period, and that would be for those that are turning 65 or maybe getting ready to retire. So when they are initially getting ready to turn 65, they would have 3 months before they turn 65, the month that they turn 65, and then 3 months after they turn 65 to make their initial election.
So they don't have to wait for that open enrollment period.
Absolutely.
Gotcha.
Absolutely.
You mentioned it earlier, but I was, just to go into a little bit more detail about Medicare Advantage, because we see a lot of commercials for that. You see a lot of advertisements for Medicare Advantage. Talk a little bit more about that.
That's a great question, a great thing to follow up with what she just said. When you're going through your initial election period, you can choose a supplement or an advantage plan. You don't have any health questions at all during that time. That changes after your initial election period. So that is very important at that time to make the right choice. So if you chose an advantage plan during your initial election period and then you chose that you wanted to go to a supplement, you then have health questions after that initial election period. So that's really important. But advantage plans are great if you're healthy. You don't really have a lot of concerns. They have a 0 premium normally. There are some plans that do have a little bit of a premium, so you'll have more choices with your doctors. They are normally network based, and you do have deductibles that can get pretty high. Around, I would say the lowest is around $3,400. The highest can be up to $7,000. Oh wow! So what we kind of say, supplements are the Cadillac plan. Advantage plans are pay as you go. Because you have a copay to go to see your primary care physician normally, specialist copay. And then you have some different, you do have some other benefits, obviously, dental, vision, health, gym memberships. But as we all know, nothing's free. So make sure that you know what your plan covers. I like them both. It just depends on where you are in your life and your health status.
So if I'm approaching 65 and I want some free, keyword free, non-biased counseling on Medicare, where can I get that?
There are several different resources out there for anyone that is wanting to get Medicare information. So you actually have your Medicare.gov website that you can visit to get all of that research. You can call the 1-800-MEDICARE number to get information. That you could also reach out to the Council on Aging, and they would be able to refer you out and give you some advice. But as far as Gulf Winds, with what I feel is different with us is, you know, if you're a member of Gulf Winds, you trust in us. So you can actually call us, schedule a time to come in and sit with us face to face. And we're going to walk you through step A, B, C, all the way through that process. And we write through several different companies. So we're going to look at all of those plans for them, and then just for their individual needs is how we're going to determine what's going to be the best fit and best product for that particular person.
Fantastic, fantastic. Well, it's extremely important information. Unfortunately, we're out of time, but thank you so much for coming on to discuss it. I appreciate it.
Thank you. Thank you so much.
And thank you for watching. Until next time, enjoy life. You've earned it.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with Level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver, or visit us in Cordova Square.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
My mother is 103 years old. She lives with me. She was not happy with coming out of her apartment. She had some Arkansas expressions for it, like we threw her in the back seat of a car just like a hog. She did not want to give up her independence at all. I didn't know what the possibilities were. I didn't know how to handle a person with dementia, and you feel quite alone. You feel like you're on an island.
It was very hard to try to work and try to take care of my father. He was very ill. It was very emotional, because I didn't have help.
So I got a very nice lady on the telephone, and she mentioned adult daycare and West Florida Council on Aging. You just kind of go, oh, so now I'm not alone.
Council on Aging exists to provide independence and dignity to senior adults who are living at home. There is a big misconception in senior care that exists. You either stay at home or you go into a nursing home. We provide that in-between care that enables seniors to remain safe and independent in their homes. Whether it's Meals on Wheels, companionship, in-home services such as bathing and hygiene so that they can remain active and engaged and make friends, and we make their life worth living.
If I didn't have Miss Annie here or the Senior Companion Program, I would have to quit my job. And that would be devastating.
A senior companion, we stay with people, we sit with people who need somebody around them or with them or some help. Their caregiver won't have to be there all the time.
Well, the first day when she came to help, I actually went to work with like a weight off my shoulders.
I have Annie. She's great company. I know I can depend on her, and that's a great thing.
I look forward to getting up in the morning and coming over here and fixing her breakfast, and talking to her.
You can tell there's a lot of care and compassion for the people that are at the service here, and that is very comforting too, to know that they want to be here.
The daycare enables us to enjoy her because she's been there for a few hours.
We're engaging their minds. Every 30 minutes, we change activities.
She sings, she dances, she loves attention.
The retreat has definitely been a safe place because my mom's a little restless and could not be by herself anymore at home. So it's her routine now. Because of her stroke, this has given her so much more stimuli before her stroke. She was a very social person, so this gave that back to her.
The program allows you to meet other people in the community. You find out that you're not alone, and it gives them something constructive to do in the process. Sometimes they'll just put on music and they're dancing, and it's a great environment.
I lost my baby child. He was 34 years old, and I didn't do well. My mother has been a foster grandparent for 20 years, and she kept trying to encourage me to do this, and I just didn't want to do anything. This program really saved my life.
The Foster Grandparent Program is a program that enables lower-income elder adults to mentor at-risk youth.
We go into the schools and we help the children who are having difficulties with their reading, math. We give them love and we talk with them and give them support outside of the school. It helped me to see things differently, and then I was able to give back to some kids, and my son that's one of the things he would have really wanted me to do.
This solves so many parts of the at-risk youth equation, of the at-risk senior adult equation. We have had some grannies been in the program for 20 or 30 years, and kids that they mentored back in the 80s are now grown with families of their own, and they still keep in touch with their foster grandparents. That's the sort of multi-generational impact that we're able to facilitate here at Council on Aging.
I'm on Social Security. After I'd pay all my living expenses and everything, I would hardly have any, money left for food. And then someone told me at the community center there, they served hot lunches every day. That's when I started, being introduced to Meals on Wheels, food that is delivered to, senior citizens. Now they have Meals on Wheels for pets, so she gets food too from the Council on Aging. What has really touched my heart and meant a lot to me is when Council on Aging got with Peden and rebuilt my AC unit and put in a new thermostat. It makes me feel good to know that there's an organization out there that cares about us seniors.
There's something about helping someone who thought they had been forgotten, who thought that they didn't matter anymore, who thought that their time was up, that is just so special. But then someone walks into your life with an air conditioner or a meal, or even just a smile and offers to spend a couple hours with you talking about the good old days, suddenly you matter. Suddenly your life has purpose again, and suddenly you have a reason to wake up in the morning. And I think that's what I really love about Council on Aging.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Calls me googly eyes.
You know you're beautiful, right? You know that?
Even you are beautiful. I got bullied for wearing glasses. Share if you're against bullying.
We put it out there, just took off. 3 million people have shared this post. Don't let bullies get you down. I stand with you. Our whole family's wearing glasses. I wear glasses and I'm proud.
I even have the army on my team.
All the kind comments brought my child joy. I don't feel thank you is enough.
Next.